What is Asperger syndrome? In 1944, pediatrician Hans Asperger described children who were clumsy, lacked nonverbal communication skills and did not express empathy. Asperger syndrome is a disorder on the autism spectrum. It's on the mild or high-function end of the spectrum. It's diagnosed in the early childhood years, and many individuals with the condition compensate and live successful lives, but the challenges of the condition lead to social isolation, difficulties at school, work and in relationships. People with the syndrome are not prone to criminal behavior because of divergent diagnostic criteria. Estimates of its prevalence vary from 1 case in 250 to 1 case in 10,000 children. Many people are undiagnosed. Asperger syndrome has no racial preference. The estimated male-to-female ratio is 4:1. The exact cause is not known. Because it runs in families, it may have a genetic basis. Anxiety disorder and major depressive disorder are common conditions seen at the same time as Asperger syndrome. Symptoms of Asperger spectrum problems with social skills. Children with Asperger's syndrome generally have difficulty interacting with others and often are awkward in social situations. They generally do not make friends easily. Eccentric or repetitive behaviors. Children with this condition may develop odd, repetitive movements, such as hand-wringing or finger twisting. Unusual preoccupations or rituals. A child with Asperger's syndrome may develop rituals that he or she refuses to alter, such as getting dressed in a specific order. Communication difficulties. People with Asperger's syndrome may not make eye contact when speaking with someone. They may have trouble using facial expressions and gestures, and understanding body language. They also tend to have problems understanding language and context. Limited range of interests. A child with Asperger's syndrome may develop an intense, almost obsessive, interest in a few areas, such as sports schedules, weather, or maps. Coordination problems. The movements of children with Asperger's syndrome may seem clumsy or awkward. Skilled or talented. Many children with Asperger's syndrome are exceptionally talented or skilled in a particular area, such as
music or math.
Genetic causes of Asperger syndrome. Brain abnormalities are the cause of AS. Imaging techniques have revealed structural and functional differences in specific regions of the brains of normal versus AS children. These defects are likely caused by the abnormal migration of embryonic cells during fetal development that affects brain structure and wiring and then affects the neural circuits that control thought and behavior. There is a genetic component to AS and the other ASDS because of their tendency to run in families. Genetic mutations and AS was observed in the higher incidence of family members who have behavioral symptoms similar to AS but in a more limited form. The family members had slight difficulties with social interaction, language, or reading. Brain function in adults with AS revealed abnormal levels of specific proteins that correlate with obsessive and repetitive behaviors. There are a common group of genes whose variations or deletions make an individual vulnerable to developing AS. This combination of genetic variations or deletions will determine the severity and symptoms for each individual with
AS.
Asperger syndrome therapies. The training of social skills for more effective interpersonal interaction. Cognitive behavioral therapy to improve stress management relating to anxiety or explosive emotions, and to cut back on obsessive interests and repetitive routines. Medication for coexisting conditions such as major depressive disorder and anxiety disorder. Occupational or physical therapy to assist with poor sensory integration and motor coordination. Social communication intervention, which is specialized speech therapy, to help with the pragmatics of the give and take of normal conversation. The training and support of parents, particularly in behavioral techniques to use in the home.